Disclaimer: this content is purely informational and is not intended to replace the advice of a qualified physician. Always consult a specialist for health-related issues. Hello and welcome to Health Pills. Today, we'll tackle a fascinating and rarely explored topic: gender differences in health, the brain, and modern medicine. What are the unique characteristics of the male and female brain? How do they influence prevention, diagnosis, and treatments? By the end of this video, you'll gain a clearer understanding of how these differences can guide personalized care and improve quality of life. Get ready to uncover a surprising world. Chapter 1: The Male and Female Brain. Structural differences. The male and female brains present significant structural differences, which do not necessarily translate to greater intelligence or abilities, but rather reflect distinct modes of functioning. One major distinction lies in the gray matter and white matter. Men have a greater volume of gray matter, which comprises areas of the brain dedicated to focus and deep processing. This is one reason why men tend to excel in tasks requiring concentration and specialization, such as solving specific problems. Women, on the other hand, have about 5 times more white matter, the part of the brain responsible for connecting various regions. This makes the female brain more adept at multitasking. Another key difference is the corpus callosum, the bridge connecting the two hemispheres of the brain, which is more developed in women. This facilitates greater communication between emotional and rational areas, possibly explaining why women can integrate emotions and logic more fluidly than men. These characteristics are not limitations but evolutionary adaptations that allowed both sexes to address different needs. Male and female brains are complementary, designed to work together rather than in opposition. Understanding these differences can help promote better relationships and more personalized care, valuing diversity as a strength. Chapter 2: Gender Medicine. Personalizing health for better outcomes. Gender medicine is a discipline that studies the biological, physiological, and psychological differences between men and women to improve the diagnosis, treatment, and prevention of diseases. For many years, clinical studies focused primarily on men, overlooking the fact that women respond differently to illnesses and therapies. For instance, some heart conditions in women present with atypical symptoms, such as nausea or back pain, which may be overlooked or misdiagnosed. Men, on the other hand, often avoid medical visits until symptoms become severe, leading to delays in diagnosis and treatment. Another critical aspect concerns medications. Women frequently experience more severe side effects than men because their metabolism and body composition, fat and water distribution, affect drug absorption and elimination. Gender medicine is not a separate specialty, but a lens through which to analyze all medical disciplines. It considers the impact of gender on cardiovascular diseases, mental health disorders, chronic pain, and even emerging conditions like autoimmune diseases. Through this approach, treatments become more targeted and effective, reducing health disparities. The future of medicine aims to ensure that both men and women receive optimal care tailored to their unique characteristics. Chapter 3: Connections and Emotions. Empathy in Women. Empathy is often associated with women, and science offers a neurological explanation for this trait. Women exhibit greater activity in the limbic system, the brain area responsible for emotions, memory, and social regulation. This increased connectivity between the emotional and cognitive regions of the brain enables women to interpret nonverbal cues and emotional nuances with great precision. It's no surprise that women are often said to read between the lines or intuit others' feelings. Men's brains, in contrast, tend to separate emotion and rationality more distinctly. This doesn't mean that men are less emotional. They often express emotions differently, frequently through actions rather than words. This difference has evolutionary roots. While men were engaged in hunting, requiring focus and emotional detachment, women cared for children and managed group relationships, developing strong empathetic abilities. However, this heightened emotional sensitivity can make women more vulnerable to mood disorders, such as anxiety and depression. The connection between the limbic system and the amygdala, a brain area involved in stress, is more pronounced in women, making them more susceptible to prolonged stress. Understanding these differences helps us better appreciate behaviors and emotional needs, fostering empathy and mutual understanding. Chapter 4: The Physiology of Pain: Why Men and Women Feel It Differently. Pain is a universal experience, but the way it is perceived and managed varies significantly between men and women. Scientific studies show that these differences are influenced by biological, hormonal, and neurological factors. Women are more sensitive to acute pain due to estrogen, which amplifies the response of nerve endings. For example, pain perception can increase or decrease during the menstrual cycle depending on hormone levels. Men, on the other hand, show greater tolerance for acute pain, likely for evolutionary reasons tied to facing injuries during hunting or conflict. However, they are more vulnerable to chronic pain, which tends to have a more significant impact on their quality of life. The way the two sexes respond to pain treatments also differs. Women respond better to certain analgesics, while men may require different dosages or combinations. These differences are essential for personalizing treatments. For example, managing chronic pain may benefit women more through psychological therapies like mindfulness, whereas men might gain more from targeted physical therapies. Understanding the unique ways men and women perceive pain not only improves care, but paves the way for more effective and less invasive treatments for everyone. Chapter 5: Evolution and Complementary Roles. The differences between men and women are not random but the result of millions of years of evolution. Our ancestors developed physical and cognitive traits that reflected roles necessary for group survival. Men, often engaged in hunting, develop skills such as a precise sense of direction, the ability to concentrate on specific objectives, and a knack for quick problem solving. These traits were crucial for tracking prey, planning strategies, and confronting immediate threats. Women, on the other hand, were responsible for gathering food and caring for children, roles that required emotional intuition, multitasking, and sensitivity to social cues. This explains why the female brain is better connected between rational and emotional areas, enabling balanced interpersonal management. Even perceptions of danger differed. Men often reacted with aggression or flight, while women adopted collective defense strategies, protecting children and the group through organization and communication. These complementary roles are no longer needed in the same way today, but continue to influence behaviors and attitudes. For example, many differences in how stress, work, and relationships are handled can be traced back to these ancestral predispositions. Recognizing these evolutionary roots helps us appreciate how men and women can collaborate and support each other, leveraging unique strengths to build balanced relationships and societies. Chapter 6: The Impact of Hormones: From Fetal Life to Adulthood. The differences between men and women begin very early, even during fetal development, thanks to the influence of hormones. In the first 2 months of gestation, the brain undergoes hormonal changes that determine whether it develops as male or female. Testosterone is the main hormone responsible for masculinizing the brain, stimulating the growth of areas associated with aggression, competition, and specialization. In contrast, estrogen and other female hormones enhance connectivity between hemispheres and increase emotional sensitivity. This process continues after birth. Between 1 and 2 years of age, a mini puberty occurs, during which hormones further influence brain development and behavior. During full puberty, these differences become even more pronounced. Men develop greater physical strength and mental specialization, while women enhance relational and empathetic skills. These changes are not confined to adolescence. Throughout life, hormones continue to shape behavior, mood, and even susceptibility to illnesses. For instance, hormonal fluctuations related to the menstrual cycle, pregnancy, and menopause can affect pain perception, energy levels, and mental health in women. In men, gradual testosterone declines over time can lead to reduced energy, mood swings, and even changes in cognitive abilities. These hormonal shifts emphasize the need for personalized care across different life stages. Understanding the impact of hormones enables us to better tailor medical treatments and develop strategies that support men and women throughout their unique life journeys. Chapter 7: Stress and Gender Responses. Stress is a universal physiological response, but men and women handle it differently due to biological and neurological differences. In men, stress predominantly activates the fight or flight response. This reaction is characterized by a surge in adrenaline and cortisol, preparing the body for physical action, a throwback to the need to face immediate threats. Men often respond to stress by isolating themselves or focusing on practical solutions to resolve the problem. Women, on the other hand, frequently employ a tend and befriend strategy. Under stress, the female body releases oxytocin, the hormone associated with love and bonding, which encourages seeking social support. This evolutionary behavior helped women protect their children and strengthen group relationships. These differences aren't just psychological, they have direct health implications. Men, for instance, are more prone to cardiovascular issues linked to stress, while women are more likely to experience emotional disorders like anxiety and depression. Effectively managing stress requires tailored approaches. Men may benefit from physical activities that help dissipate built-up energy, while women often find relief through dialogue and emotional sharing. Recognizing these distinctions helps us provide better support for individuals under stress, addressing their specific needs and fostering resilience. Chapter 8: Mental Health, Anxiety, Depression, and Gender Differences. Mental health is deeply influenced by gender, with men and women displaying different predispositions to specific conditions. Women are twice as likely as men to suffer from depression during their fertile years due to hormonal fluctuations that affect serotonin levels, the neurotransmitter associated with happiness. Life events such as pregnancy, postpartum, and menopause can further amplify the risk of emotional disorders. Men, however, often suffer in silence. They are less likely to seek help for emotional problems and tend to mask anxiety and depression through behaviors like irritability or substance abuse. This often leads to delayed diagnoses and, tragically, higher suicide rates compared to women. Another key difference lies in how the two genders cope with emotional stress. Women frequently rely on social networks, finding comfort in dialogue and mutual support. Men, conversely, prefer to solve problems independently, which can heighten their sense of isolation. Personalized interventions can make a significant difference. Hormonal, psychological, and pharmacological therapies, combined with targeted prevention strategies, can help both genders improve their mental health. Understanding these differences is vital for providing appropriate support and promoting a culture that prioritizes mental well-being for all. Chapter 9: Neurotransmitters and Love Biology of Feelings. Love is one of the most complex and fascinating emotions, deeply influenced by brain chemistry. When we fall in love, the brain releases a cascade of neurotransmitters that create feelings of euphoria and emotional bonding. The first player is dopamine, the neurotransmitter of reward. Being with the person we love triggers dopamine spikes, making us feel happy and energized. This state of emotional addiction is comparable to the effects of certain drugs. Over time, love evolves. The initial phase of passion transitions into a more stable and profound bond, supported by oxytocin, the bonding hormone. This substance, produced during physical contact and sexual activity, promotes trust and tranquility. Other hormones, like serotonin, also play a role, influencing mood and how we perceive our partner. However, love isn't just chemistry. Personal experiences, values, and spirituality all contribute to making this emotion unique to each individual. Understanding the biology of love helps us manage relationships better, maintaining strong and fulfilling bonds over time. Chapter 10: The Future of Gender Medicine. Gender medicine is transforming how we think about health, offering personalized care based on the differences between men and women. The future of this field is promising, with ambitious goals. Developing drugs specifically tailored for both sexes. Improving prevention through targeted genetic and hormonal testing. Educating doctors and patients on the importance of considering gender in diagnosis and treatment. Emerging technologies like artificial intelligence are revolutionizing research by analyzing vast data sets to identify subtle but significant differences between men and women. This revolution extends beyond physical diseases to mental health and overall well-being, promoting a more inclusive and human approach. Gender medicine represents the future of personalized care, offering hope for better health outcomes for everyone. Conclusion: in this video, we've explored how gender differences influence health and medicine. Diversity is not a limitation, but a valuable resource for better understanding ourselves and taking care of our bodies and minds. If you enjoyed this content, don't forget to like the video. Subscribe to our Health Pills channel and turn on the notification bell to never miss future videos. Remember, every body is unique and deserves personalized attention. See you next time, and as always, stay healthy.